Welcome to the In My Opinion Show with Ronald, Barry, Robinson, and friends, seen on the internet 24 hours, 7 days a week. I want to welcome our millions of viewers worldwide, but first I want to recognize and welcome our very talented co-host, Miss Dr. Denise Smith-Allen.
Hi, Ron.
And Mr. Henry Hatter.
Thank you, Ron. And hi, Denise.
Hello.
Dr. Denise.
Hello. Ron. Okay.
Let's talk about health care. Will it pass the Senate? Why? In its present form, from what I've been able to glean off of the news and the newspapers and magazines, under its present form, no. Because it disadvantages or denies over 23 million Americans. They will have no coverage under this Republican reform. Millions of Americans need health care, and in fact everybody needs health care. Let's talk about health care, all right? Because you can go to the hospital, and get care, but I'm talking about health care that is somehow sponsored in part by the person or the government. Okay, we live in the richest country in the world, and why the Trump administration wants to deny 23 million Americans and especially when you get 50 or 64, they're talking about you got to pay a tax, age tax. They're stealing from Medicare. If it passes, they're going to steal from Medicare. They're going to tax us more so on our retirement, our pensions and things of that nature. All right, but yet everybody, in my opinion, that Trump has appointed and nominated, all right, to his gang are millionaires. They got their money. When Trump leaves office, if he doesn't go to prison, which I hope he does, all right, all them senators and representatives, they have insurance for the rest of their lives. So they're set. They should not discard 23 million Americans plus probably more than that, like they're a piece of garbage. That's not the American way. Henry, what are you?
Ron, I'm glad you said that something is not the American way, because there is an American way. And the reason, and I'm really pleased that Trump does not have to steal from the government because he has his own money. And all of those rich people he appointed to positions of authority don't have to steal from the American people. But everybody in this country has health insurance. It's called government-funded health insurance. It's called Medicaid, Medicare. Everybody. But the kind of insurance that they want, the insurance that you either buy through the exchanges, and Michigan has that, and if you don't have insurance, and it's mandatory on the federal law that everybody, under the Obama law, that everybody buys into the exchanges. Everybody has to pay for it. Wasn't a bad plan. Everybody pays in it. See, that was the point that I was trying to make earlier with everybody must pay into the system. You say they're cutting social programs, but everybody must pay into the system to stabilize the system, because you don't want one segment of people in the population saying, well, you're giving something to someone else for nothing. We want everybody to have at least some commitment to make the system work. Without those 23 million people paying into exchanges, it won't work. Because what you're doing is feeding insurance for a new generation. It's just like the insurance that we have in school systems and the retirement benefit fund.
So what are you saying? If these 23 million don't get involved, then you just throw them to the trash heap, right?
No, I didn't say that.
You
You said that.
No, you might just as well have said it.
Well, I didn't say that.
Okay,
And if,
maybe not in
that
words.
sounded that way, it was not intended to be that way. But we do have, and this came out of the Obama administration, where it was formulated and produced an insurance plan that where all Americans would have insurance under Obamacare. But that had stipulation that you had to pay something to get into it, like through the exchanges. Now, the other kind of insurance that you buy into is that you work for an employer. And the employer must pay part of the insurance tab. Those jobs are disappearing.
Right.
Employers vacate. As long as there's Obamacare. And
It's the Affordable Care Act.
Oh, okay. I like Obamacare. Okay, Affordable Care Act. I'll be nice. But as long as there is the Affordable Care Act, all Americans will have insurance. Now notice, that is still the law. It has not been repealed yet. So, and remember, we took almost 10 years to build the American Affordable Care Act, okay? In the next decade, and that was done by Democrats, right?
Right.
Now, Republicans want to spend this just a little bit to put their version in it. And then once they refine it, it becomes the American, they don't call it Affordable Care Act, they call it American Health Care Act, right? ACH or something like that. And then that's finalized, and that would become the law of the land. And we'll have the approval of all of the American people. That's the only way it's going to work, guys.
It'll be called Trumpcare.
Well, you can call it Trumpcare, but it's the same thing.
You know, and it shouldn't be touched. Plus, I forgot to mention a couple things too. Now, they're talking about, the Republicans are also talking about mental illnesses and depressions, and depressions are pre-existing conditions. Now, that's beyond my comprehension, and it's so.
I know some people that like that.
So do I.
Wow. You know, I'm going to jump in this discussion, and I just want to say that I think about children who are born, and some of them have illnesses, who are certainly not even in a position to work. Maybe their parents have worked, but because of their debilitating illnesses, they may have to not work so they can spend time taking care of those children. The Affordable Care Act, or the act as it will evolve, I think they have to take into account those kinds of things, because I heard Henry say, you know, everybody should pay something. Well, you know, in those circumstances, people are not in a position to pay, but yet they want their children to be healthy and live. So they're going to do all that they can, and thankfully there are places like St. Jude's and other organizations that through donations and what have you help offset those costs. But if you look at how the people who are running the country, how they're able to maintain their health by virtue of not only the money that they make, but because of the health care that they have, I feel as though if they have it, why can't I have it? Why can't you have it? You know, we should be able to be taken care of to the degree that they're taken care of. You understand? So they're being cared for by what we perceive to be, and is probably true, the best. They get the best health care, they get the best tests, they go to the hospitals, and they get whatever it is that they need. And I'm thinking that in America, that should be something that everyone should have an opportunity to have. So this thing will go back and forth in Congress. It's going to get watered down, it's going to get changed, and I would think probably within the next 8 to 10 years, we will come back with something. But in the meantime, the way it stands now, and you know, we've heard where, you know, a number of people, thousands of people will be kicked off And these probably were some of the same people who voted, for the present administration, thinking that they were going to be beneficial to them. But as we're finding out, it doesn't appear that way. It does not appear that way. So we have to, be vigilant and diligent in making sure that you stay in touch with your congressperson and your senator and let them know that, we don't want anything less than what they have.
Well, good luck. But
I know that, but I'm just saying. But we don't, why should we be penalized?
But you raise a good question here, and I support that point, that all Americans deserve the same kind of health care that, no, not deserve, ought to have the same kind of health care that the people in Congress have. Exactly. But when you really argue that in the way that that's been built and framed, we look at our Congress people and our people elected to higher office in public service as as disciples of the federal government. That means that they belong to the federal government, just like military men do. Hang on, guys. They belong to the military, and the military has an obligation. And I'm not saying that it ought to be that way, but that's somehow our leaders do get the best of the health care insurance. And there's an argument. There's a rise from below where people want to change that. And it's Republicans are as critical as Democrats on that.
Well, you just raised an interesting point too, because you talked about the military.
Yeah.
And in the military, these poor folks come back from fighting and they get the worst treatment ever. Yes, they have the VA hospitals and things like that, but that's been scandalous in terms of how they've mismanaged and mistreated people, so they're not getting what the senators and the people who are working in
well, as we get better human beings and learn to really appreciate the dilemma, the experience that we all have going through life, maybe someday we will reach that pinnacle. But right now, with the people who live, I got to die first before you guys can get there.
But how long should it take? I mean, we've been battling, our men and women in uniform since the first wars here in America. Okay, and it's still continuing. I was down at the Veterans Hospital there in Detroit a couple weeks ago. I mean, it's just appalling. All right, when you see not the condition of the hospital, but the condition of the veterans in there. All right, I mean arms and legs and feet and and blown off. All right, and you got to then talking to some of their loved ones. I mean, my goodness, you got to battle. Hook and nail to get service. Now no. It shouldn't be that way.
And that's a good segue for me to bring this back up. And not to salute the flag for these men whose body parts are laying all over hospitals and stuff, so that we can walk around and enjoy fresh air and good water and great food, the best burial expenses possible. It's a charade.
What's a charade?
Not to pledge allegiance to the flag, because the boys who died in military kind of epitomizes that.
Well, my thing is
sacrifice.
This. My thing is this, all right? I appreciate the flag, all right?
I don't want to do it.
And I don't have a problem, with saluting the flag, but I have a problem with the Pledge of Allegiance. Like we had a conversation earlier, all right? Until me as a black man and other blacks as well as women get the equal treatment and justice, as the Pledge of Allegiance says, equal justice for all. Until that's achieved, I'm not gonna pledge allegiance. I'm not gonna recite that. And I know why it's done, because it's been that way for forever, okay, in the schools. And when I was probably in the kindergarten, we were up there,
Right.
doing this, okay? And my parents, for them too, when they were in school, all right, in their lifetime.
But we're on
You know what I mean?
healthcare now. I didn't want to
No,
sidetrack you
that's
too much.
not. Well, I know we're on healthcare, but I'm talking about the Pledge of Allegiance. All right, why I don't recite the Pledge of Allegiance. That's me
Okay.
personally.
Okay, but we want to get back
Okay.
to the health system. And we know that the health system is divided. The health system, as we know, there are people who are not being serviced, and they are usually poor and minority, okay? And yes, we do have Medicaid and Medicare, but if you look at those systems, we still find that the testing, the diagnosis, and all of that kind of thing that happens with people, it happens in a much slower, if at all, for the people to get the kind of care that they need. And so we have to be mindful. I always think about, and I'm very blessed, number one, that my mother was a registered nurse, many years, and because of her understanding of the health system, she did a lot of things to make sure that we maintain our health, okay? And always the thought was, don't get sick. Don't get sick, so you do the things that were preventive. But there are a lot of people out here who, because of poor diet and because of heredity and so many other things, there are situations where these people have long-standing illnesses or have to have maintenance drugs in order for them to live. So it goes back to what is fair, what is equitable, what is meaningful for the people of this United States as far as their health is concerned. What can we do? We have this Affordable Care Act right now, and right now they're trying to water it down, change it, and make it less beneficial for the people. And for those people, again, we go back to minority and poor. And sometimes it's and or it's both.
Plus, America has lost its, in my opinion, America has lost its humanity. Okay, the humanity has eroded to the abyss. Yes, Henry.
Denise brings up a good point about how minorities are bypassed in the substance of the system, if you will. And there are reasons that happens, Denise. We don't have advocates, lobbyists, to speak for the black community. Now, hang on before you get mad at me. Because everybody else does. The health lobbies. And we have to educate our people to the degree where they go out and specifically lobby for things that need to be accomplished in the black community. Because the lobbyists that are currently doing it, or the system, it doesn't see you.
It's not just black folks. It's
Well, I know
Hispanics.
that.
It's poor
Yeah.
women.
I'm following that direction.
Minorities.
Okay.
Yeah. Okay.
But you keep
I
saying
know.
black, and you want to pigeonhole black folks, and that's not fair.
I was lifting them up.
No, you weren't.
Okay.
Okay, in my opinion.
Okay. Well, that's your opinion.
You got blacks, you got Native Americans, you got Chinese, all right, that helped build this country. All right, you got the Irish.
People
You
say
got
I don't.
all sort of different nationalities.
People think that I don't support the black agenda. That's wrong, because I do, and I try to do it the best way I can. I can't speak for all people, because I say, I get told, well, you don't support black people, but I do.
And there's nothing wrong with supporting black folks, but you got to include.
We're being
the
very
rest
specific about it, because Denise mentioned that. Very specific. And even if I didn't include them, there are other people that have included these other people. They have lobbyists. I'm talking about the people who don't have a lobby to do this. And black people don't have a lobby to do it. Hispanics, Arabs, all the other people have lobbies. And we can't work well together.
Why do you think we don't have lobbies?
Well, nobody's ever presented that, opposed that to a structure of educated and responsible for black Americans.
Well, Henry, I know that over the course of several years, there was a gentleman, and right now I'm trying to pull his name up out the hat here, but he used to have this meeting, was, basically was dealing with the black agenda. Tavis Smiley, that was
Tavis Smiley, yeah.
So he used to have a convergent of all of the intellectual leaders, the people who from every portion, I guess, of society that will be able to speak about the things and then come up with an agenda. Al Sharpton is another one who also through the Action Network comes up with these agendas. So I'm curious.
He didn't have the right people at the table. You got to have for anything to work, you got to have the right people at the table. And everybody's not the right person. You can't go there wanting to fulfill dreams of your own. You got to go there because you want to represent the people that you've been asked to represent. That's what lobbies can do that nobody else can do.
Okay.
We can hire all white lobbyists for blacks, and they'll follow that line. They'll neither look to the right nor the left, but they will follow their targeted agenda. Now, you ask me why it is that we don't have more results from that, but Tavis Smiley and all that. They didn't have the right people at the table. You're going to pay for that. I stand arrested, and I'm going to let you guys have the rest of it.
If we don't speak, whether we like them or not, black people or whomever, whether we like them or not, who else is going to speak for us?
That's why we must have lobbies.
Whites are not going to speak for us.
Lobbies,
they don't know, they've never walked in our shoes.
But they don't have to. You tell them what you want. That's what the lobbyists will do for you. They don't care about color.
That's an interesting perspective, but I dare to say, I would challenge you on the fact that there are already lobbyists out there. I just threw out those names because I know that those persons are the
but they're ineffective if they... We got to change, guys. We got to get better.
Oh, absolutely we do. We have a lot of people who do a lot of talking and saying nothing.
Yeah.
That's right.
Okay, so that's why I just... bring up this discussion because...
Was that a good response to your question?
I think it was. I think it was
that
because
you could hire
right people at the table.
Soldiers of fortune.
Yeah. Right people at the table is very essential to our life. Okay, but if we go back to this whole premise of healthcare, who else could be speaking to our agenda as far as health? Would be your medical professionals who are minorities. Because they would benefit not only by having more people coming to see them, but overall it would lift up the community.
But they can't do it by themselves. It takes someone who understands public service.
Absolutely it does. But I'm just saying, I throw that out because I'm saying that that's a call for them to step up, because here it is, your livelihood, number one, will depend on it. But not only that, which should be the primary reason why you got into the healthcare business in the first place, is to make sure that people live healthier lives.
I think we're on to something here. And we're just talking loosely about this, but I think we're on to something. And maybe some of the people who understand this process and have the money and the willpower and the credentials can help do that. But this has to be formed as a single entity in one spot. It doesn't have to be Washington. It can be Detroit or Flint or whatever. Just to create that enthusiasm and drive to create a lobby and sell it nationwide. And it would become something of vantage for us, for black people.
How would one go about establishing? I know it takes money, but then again, you have to pick the right personnel.
You don't have to. You have to generate venture capital for that. That means that you got to take money out of your pocket, hers, and ours, and we collect it here, and then we decide what we want to do, and then we hire the right kind of a lobby to go out, and this is really great because you can measure your progress. Because they have to produce something, and if they're not producing, you get rid of them. Absolutely. Or you change the perspective. But the way we're going now, we'll probably flounder for the next lifetime.
No, I have faith
I don't.
in people. I
But
really
as
do.
resources decline, guys, and population rises, and we become mixed, and so on and so forth, and other people siphon off the true wealth of the system, there'll be little left.
You know, the population is rising in other countries, but from statistics here in the United States, it's not. Okay, it's seems to be leveling off or slightly down from years ago. So all I know is that, and I know I can speak for you two, as well as you want the best for your families, all right, as well as I. But you got those people out there that are only thinking of themselves, all right, are only thinking of themselves, and I think that's totally wrong. But until next time, this is Ronald Barrington Robinson and friends saying, stay focused.